CNA Practice Test Part 1 Role Rights and Communication.
Question 1. What is the main role of a certified nursing assistant, CNA? Option A. To prescribe medications. Option B. To perform surgeries. Option C. To provide basic patient care under the supervision of a nurse. Option D. To diagnose medical conditions.
The correct answer is option C. To provide basic patient care under the supervision of a nurse. The primary role of a CNA is to assist patients with activities of daily living, ADLS, and provide basic care under the supervision of an RN or LPN.
Question 2. Which of the following represents a violation of a patient's right to privacy? Option A. Knocking before entering the room. Option B. Closing the privacy curtain during a bed bath. Option C. Discussing a patient's condition in the cafeteria. Option D. Draping the patient properly during procedures.
The correct answer is option C. Discussing a patient's condition in the cafeteria. Discussing patient information in public areas violates the Health Insurance Portability and Accountability Act, HIPAA, and the patient's right to privacy.
Question 3. If a patient refuses to take a bath, what should the CNA do? Option A. Force the patient to bathe. Option B. Tell the patient they will smell bad. Option C. Respect the refusal and report it to the nurse. Option D. Call the patient's family to complain.
The correct answer is option C. Respect the refusal and report it to the nurse. Patients have the legal right to refuse treatment or care. The CNA must respect this right and report the refusal to the supervising nurse.
Question 4. Which of the following is considered objective information? Option A. The patient says their head hurts. Option B. The patient complains of nausea. Option C. The patient feels sad. Option D. The patient has a blood pressure of 120/80.
The correct answer is option D. The patient has a blood pressure of 120/80. Objective information, signs, is factual and measurable, such as vital signs. Subjective information, symptoms, is based on what the patient reports.
Question 5. What is the best way for a CNA to communicate with a patient who is hearing impaired? Option A. Speak as loudly as possible. Option B. Speak clearly slowly and face the patient. Option C. Turn off all the lights in the room. Option D. Cover your mouth while speaking.
The correct answer is option B. Speak clearly slowly and face the patient. Facing the patient allows them to see facial expressions and read lips. Speaking clearly and slowly is more effective than shouting.
Question 6. If a CNA suspects that a resident is being abused, what is their legal responsibility? Option A. Investigate the abuse themselves. Option B. Keep it a secret to protect the facility. Option C. Report the suspicion immediately to the charge nurse. Option D. Confront the suspected abuser.
The correct answer is option C. Report the suspicion immediately to the charge nurse. CNAs are mandated reporters. Any suspicion of abuse, neglect, or misappropriation of property must be reported immediately to the supervisor.
Question 7. Which of the following is a sign of physical abuse? Option A. Unexplained bruises or welts. Option B. The resident asking for more food. Option C. The resident wanting to sleep late. Option D. The resident watching too much television.
The correct answer is option A. Unexplained bruises or welts. Unexplained bruises, welts, burns, or frequent injuries are classic signs of physical abuse that must be reported.
Question 8. When answering a facility telephone, how should the CNA respond? Option A. Say hello and wait for the caller to speak. Option B. State the facility name, their own name and their title. Option C. Ask, who is this? Option D. Put the caller on hold immediately.
The correct answer is option B. State the facility name, their own name and their title. Professional telephone etiquette requires stating the name of the facility, your name, and your title so the caller knows who they have reached.
Question 9. Which of the following falls outside the CNA's scope of practice? Option A. Assisting with feeding. Option B. Emptying a urinary catheter bag. Option C. Administering oral pain medication. Option D. Documenting fluid intake.
The correct answer is option C. Administering oral pain medication. Administering medication is outside the scope of practice for a standard CNA and is the responsibility of a licensed nurse.
Question 10. What does the term empathy mean in nursing care? Option A. Feeling pity for the patient. Option B. Understanding and sharing the feelings of the patient. Option C. Telling the patient everything will be fine. Option D. Ignoring the patient's emotional needs.
The correct answer is option B. Understanding and sharing the feelings of the patient. Empathy is the ability to understand and share the feelings of another person, which helps build trust and rapport with patients.
Question 11. A resident's family member asks for detailed information about the resident's medical diagnosis. What is the CNA's best response? Option A. Read the medical chart to them. Option B. Tell them what you think the doctor said. Option C. Direct the family member to the charge nurse. Option D. Refuse to speak to them.
The correct answer is option C. Direct the family member to the charge nurse. CNAs should not disclose medical diagnoses or detailed treatment plans. This information should be provided by the nurse or doctor.
Question 12. Which document outlines the rights of individuals living in a long-term care facility? Option A. The Resident's Bill of Rights. Option B. The Facility Handbook. Option C. The CNA Code of Ethics. Option D. The Employee Policy Manual.
The correct answer is option A. The Resident's Bill of Rights. The Resident's Bill of Rights is a legal document that guarantees certain rights and protections for residents in long-term care facilities.
Question 13. If a CNA makes a mistake while documenting in a paper chart, what is the correct way to fix it? Option A. Use correction fluid, white out. Option B. Erase the mistake completely. Option C. Scribble over the mistake so it cannot be read. Option D. Draw a single line through it, write error, and initial it.
The correct answer is option D. Draw a single line through it, write error, and initial it. Legal documentation requires that mistakes remain legible. A single line should be drawn through the error, labeled as an error, and initialed.
Question 14. What should a CNA do if they do not understand an assignment given by the nurse? Option A. Ask another CNA to do it. Option B. Guess what the nurse meant. Option C. Ask the nurse for clarification. Option D. Ignore the assignment.
The correct answer is option C. Ask the nurse for clarification. To ensure patient safety, a CNA must always ask the supervising nurse for clarification if they do not understand an instruction or assignment.
Question 15. Which of the following is an example of nonverbal communication? Option A. Talking on the phone. Option B. Writing a letter. Option C. Facial expressions and body language. Option D. Reading a book aloud.
The correct answer is option C. Facial expressions and body language. Nonverbal communication involves conveying messages without words, such as through facial expressions, gestures, posture, and eye contact.
Question 16. A patient is crying and seems upset. What is the best action for the CNA to take? Option A. Ignore the patient to give them privacy. Option B. Tell the patient to stop crying. Option C. Sit with the patient and listen if they want to talk. Option D. Turn on the TV to distract them.
The correct answer is option C. Sit with the patient and listen if they want to talk. Offering a listening ear and providing emotional support shows empathy and respects the patient's psychosocial needs.
Question 17. What is the term for confining a person against their will? Option A. Assault. Option B. Battery. Option C. False imprisonment. Option D. Negligence.
The correct answer is option C. False imprisonment. False imprisonment is the unlawful restraint or restriction of a person's freedom of movement without proper medical authorization.
Question 18. Which of the following behaviors promotes resident independence? Option A. Doing everything for the resident. Option B. Encouraging the resident to do as much as they can for themselves. Option C. Rushing the resident during dressing. Option D. Feeding the resident even if they can feed themselves.
The correct answer is option B. Encouraging the resident to do as much as they can for themselves. Promoting independence helps maintain the resident's physical abilities, self-esteem, and dignity.
Question 19. What does HIPAA primarily protect? Option A. The facility's financial records. Option B. The patient's health information and privacy. Option C. The CNA's employment rights. Option D. The doctor's medical license.
The correct answer is option B. The patient's health information and privacy. The Health Insurance Portability and Accountability Act, HIPAA, is a federal law that protects the privacy and security of a patient's health information.
Question 20. When a resident presses their call light, what is the CNA's responsibility? Option A. Answer it when they have free time. Option B. Ask someone else to answer it. Option C. Answer it promptly. Option D. Turn it off from the hallway.
The correct answer is option C. Answer it promptly. Call lights are a vital communication and safety tool. They must be answered promptly to address the resident's needs or emergencies.
Question 21. Which of the following is a barrier to effective communication? Option A. Active listening. Option B. Using medical jargon the patient doesn't understand. Option C. Making eye contact. Option D. Speaking in a calm voice.
The correct answer is option B. Using medical jargon the patient doesn't understand. Using complex medical jargon can confuse the patient and act as a barrier to clear, effective communication.
Question 22. A resident is visually impaired. How should the CNA serve their meal? Option A. Place the food anywhere and leave. Option B. Describe the location of food using the face of a clock. Option C. Feed the resident automatically. Option D. Tell the resident to find it carefully.
The correct answer is option B. Describe the location of food using the face of a clock. Using the clock method, example P's are at 3 o'clock helps visually impaired residents locate their food and promotes independence.
Question 23. What is the term for failing to provide appropriate care leading to harm? Option A. Malpractice. Option B. Neglect. Option C. Assault. Option D. Slander.
The correct answer is option B. Neglect. Neglect is the failure to provide necessary care or services, which results in harm, pain, or mental anguish to the patient.
Question 24. When entering a resident's room, what is the first thing a CNA should do? Option A. Turn on the TV. Option B. Start cleaning the room. Option C. Knock and identify themselves. Option D. Check the resident's closet.
The correct answer is option C. Knock and identify themselves. Knocking and identifying yourself respects the resident's privacy and dignity, as their room is their personal living space.
Question 25. If a resident offers the CNA a $20 tip for good care, what should the CNA do? Option A. Accept it and say thank you. Option B. Accept it but keep it a secret. Option C. Politely refuse and explain that facility policy prohibits accepting tips. Option D. Donate it to a charity.
The correct answer is option C. Politely refuse and explain that facility policy prohibits accepting tips. CNAs must maintain professional boundaries. Accepting tips or gifts from residents is generally prohibited by facility policies and professional ethics.
Question 26. Which form of communication involves the tone of voice and the way words are spoken? Option A. Nonverbal communication. Option B. Verbal communication. Option C. Paraverbal communication. Option D. Written communication.
The correct answer is option C. Paraverbal communication. Paraverbal communication refers to the tone, pitch, volume, and pacing of the voice, which can significantly alter the meaning of spoken words.
Question 27. What is the best way to handle a resident who is confused and disoriented? Option A. Argue with them to correct them. Option B. Provide a calm environment and use short, simple sentences. Option C. Ignore their confusion. Option D. Speak to them as if they are a child.
The correct answer is option B. Provide a calm environment and use short, simple sentences. Providing a calm environment and using short, simple sentences helps reduce anxiety and makes communication easier for a confused resident.
Question 28. A CNA observes another staff member yelling at a resident. What type of abuse is this? Option A. Physical abuse. Option B. Sexual abuse. Option C. Financial abuse. Option D. Verbal/emotional abuse.
The correct answer is option D. Verbal/emotional abuse. Yelling, name-calling, or threatening a resident constitutes verbal and emotional abuse, which causes mental anguish.
Question 29. What does the term ombudsman refer to? Option A. A type of medical equipment. Option B. An advocate who investigates complaints and protects residents' rights. Option C. The facility's director of nursing. Option D. A state health inspector.
The correct answer is option B. An advocate who investigates complaints and protects residents' rights. An ombudsman is a legal advocate for residents in long-term care facilities who resolves complaints and protects their rights and dignity.
Question 30. Why is it important to report a patient's change in condition to the nurse? Option A. Because the CNA is not allowed to document. Option B. Because it may indicate a serious medical problem that requires intervention. Option C. Because the family needs to be billed. Option D. Because it is required by the police.
The correct answer is option B. Because it may indicate a serious medical problem that requires intervention. Early reporting of changes in a patient's physical or mental condition allows the nursing and medical staff to intervene before a problem becomes critical.